Hi, my name is Allison Sadowsky, and this is my self-care teaching plan. According to the U.S. Department of Health and Human Services, in 2014, heart disease is the leading cause of death in the United States. I select a patient with a new diagnosis of congestive heart failure, as there are many lifestyle modifications these patients can take to increase their health while managing their disease. My patient would benefit from a teaching session to review the pathophysiology of his newly diagnosed congestive heart failure and the changes in self-care that he can take to increase his future outcomes. My patient is a 69-year-old male that still helps out on the farm. He had been feeling short of breath for the past 3 weeks, but it had gotten worse over the past 6 hours prior to his arrival to the emergency department. His oxygen saturation was dipping into the 60s, and upon examination, he was found to have 2+ pitting edema. His troponin and CBC were normal. His electrocardiogram showed that he had atrial fibrillation with a rate of 113, and his chest x-ray showed that he had pulmonary congestion. His proBNP was 3,356, and his echocardiogram revealed that he did have a preserved ejection fraction of 60%, however, it did show that he had some diastolic dysfunction. He has a history of atrial fibrillation, and his home medication list showed that he was on Coumadin, bisoprolol, and some vitamins. He was diagnosed with acute diastolic congestive heart failure due to his poor rate control of his atrial fibrillation. According to Esrar al-Hag in 2014, atrial fibrillation causes a loss of A wave, or no atrial systole, and a beat-to-beat variation in the LV filling and ejection. The heart is not pumping effectively, and the atrial to ventricle filling time is diminished, causing the left ventricle to ineffectively fill during diastole. According to McCants and Huther in 2014, 2 areas of pathophysiological changes in the ventricle have been identified in diastolic dysfunction. First, decreased compliance of the left ventricle, and second, abnormal diastolic relaxation. Diastolic heart failure causes the heart muscle to become very stiff. This is precipitated with atrial fibrillation, as the resting period for the heart, or diastole, is not utilized appropriately. My patient is a bachelor and needed to initiate some lifestyle changes to increase his quality of life. I initiated a self-care teaching plan for him in hopes that even a few changes would occur and improve his life. According to Nicholson in 2014, education empowers patients to increase successful self-management. I selected Dorothea Orum's self-care theory to guide me in building my teaching plan. According to O'Shaughnessy in 2014, Orum's theory postulates that people have a natural ability for self-care, and nursing should focus on identifying these deficit areas. During my teaching, I will identify where his deficits are in his self-care and give him things that he can do to increase them in the future. My Healthy People 2020's leading health indicator that I concentrated on for my patient was nutrition, physical activity, and obesity. I focused on his diet and activity because, according to the U.S. Department of Health and Human Services in 2014, a healthful diet, regular physical activity, and achieving and maintaining a healthy weight are paramount to managing health conditions so they do not worsen over time. I set one broad outcome for my patient, which was the patient will state at least 3 lifestyle modifications he should focus on for optimal future outcomes. Now to the education. First, I provided my patient with a Living Well with Heart Failure booklet from Sanford in 2012. I first showed him a diagram of a normal heart and explained to him first the normal blood flow of the heart and explained the chambers, as well as I reviewed the terms diastole and systole. Then I explained to him that atrial fibrillation is when the heart is not pumping appropriately or fibrillating, and it causes his heart to have to work when it's supposed to be resting. I then showed him the illustration of the heart that shows the stiffening that occurs during diastolic heart failure, and we reviewed that the heart is not relaxing appropriately and becomes stiffer, and then the heart is not pumping appropriately to the body. I then provided him with a My Daily Treatment Plan for Living with Heart Failure from Stanford in 2012. This tool breaks education down into 4 easy categories for patients to focus on when they're discharged, and activity is the first category, so we reviewed that first. For heart failure patients, it is important to encourage activity, however, balancing it with periods of rest to ensure no overexertion. For my patient specifically, I encouraged him to find times to rest and elevate his feet, as he is still helping out on the farm, and I wanted to ensure that he was going to be able to get that accomplished. The second category is nutrition or diet, and for heart failure patients, it is important to review a low sodium diet and fluid restrictions. According to Sun, Lee, and Song in 2011, heart failure patients who followed a sodium restricted diet of less than 2.76 grams per day with a fluid restriction of less than 1 liter per day had a lower incidence of cardiac hospitalization and death. This was going to be new for my patient, so I did try to break it down as easy as I could. First, I encouraged him not to add salt to his diet, as 1 teaspoon of salt is about 2,300 milligrams of sodium, and this would be about his daily allotment. Second, I broke it down into 4 easy categories for him. First, he needed to stay away from vegetable juices such as V8 or tomato juice. Second, he needed to stay away from canned foods such as canned soup or vegetables. Third, he needed to stay away from processed meats such as ham, bacon, sausage, bologna. And then also to stay away from his processed or prepackaged foods such as frozen pizzas, boxed dinners, snack foods such as popcorn, pretzels, chips, and then other prepackaged foods like ramen noodles, rice-a-roni, boxed macaroni and cheese. The third category is medications. I provided the patient with a pill planner as I knew he was going to be discharged on new medications, and I thought this might aid him for future compliance with his medication regimen. Due to the possibility of medication changes, I did review the medications with him, but I also got a pharmacy consult so they could review the medications just prior to discharge. And the last category on this side is the self-care section. I reviewed with him daily weight monitoring and the importance of consistency and timing of those daily weights. I also provided him and educated him on a daily weight log, as well as provided him with a digital scale to ensure compliance of the daily weights. According to Veroff et al. In 2012, daily weight monitoring is essential because dramatic changes in body weight are indicative of fluid balance issues. I also encouraged the patient to keep any appointments we have scheduled for him, even if he was feeling better. And I also encouraged him to monitor his symptoms daily. For example, when he was putting on his trousers or his socks, to monitor for swelling in his legs, feet, or tummy area. The second side of this tool is our heart failure zones, and this breaks it down into 3 zones: a green, a yellow, and a red zone. And each zone has 2 columns. The first column is what the patient is experiencing, like signs and symptoms, and the second section is what they're to do if they're in that section. So first we reviewed the green section. This is the good zone. So the patient would be experiencing things like no weight gain, no chest pain, no swelling, and no shortness of breath. And if he was in that section, he was encouraged to continue his weight monitoring, his low sodium diet, his medications, and then follow any appointments that we have scheduled for him. The yellow zone, he would be experiencing things like a weight gain of 2 pounds from one day to the next, or 3 to 5 pounds in a week, increased shortness of breath, increased swelling, a cough with maybe some yellow, green, or pink frothy sputum. And if he was in this category, he was encouraged to call myself, his transition coordinator, and I did provide him with my number. If he was unable to reach me, I did also provide him with a generic number that he could contact the provider on call. The third category, or the third zone, is the red zone, and this is the caution zone. If he's in this zone, he would be experiencing things like chest pain, weight gain of over 6 pounds, dizziness where he feels like he's gonna faint, shortness of breath, that's when he's not even in activity, swelling that's severe to the point where he can't get his boots on. If he fell into this zone, he was encouraged to either present to the emergency department or the walk-in clinic, or if he had an appointment with his provider that day, that would be appropriate as well. I have the unique situation in that I follow up with my patients with the transition program. I know that this teaching session was a success due to my follow-up with my patient. His weight has dropped an additional 6.4 pounds since discharge, and he was able to give me his daily weight, so I knew he was doing that. He was also able to give me what he had eaten in the past 24 hours, and I knew that his choices were pretty good choices for a low sodium diet. And also when I called him, he did refer to his yellow, green, and red sheets, so I knew that he had his own teaching tool and he was referencing at home. In summary, my patient had a potential to be a very difficult patient to instill lifestyle modifications. It was successful due to the fact that I kept things simple, the terminology simple, and easy for him to understand. Heart failure diagnosis is often very overwhelming, and keeping things simple is very important. I also broke things down into easy categories for him to remember. And lastly, I was able to follow up with him weekly via phone calls to ensure compliance. This is always a great option if available, as patients are very stressed when they're in the hospital and may not catch even half of the content that's reviewed during education sessions. This follow-up allows for reinforcement of any content that might be missed. Here are my references, and thank you for viewing my self-care teaching plan.